The FDA has authorized the Pfizer COVID-19 vaccine for children between the ages of 5 and 11. And joining us now to discuss the vaccine approval is Dr. Anthony Harris. He is the CEO and medical director at HFit Health. Welcome to the show.
Thank you so much, Elizabeth.
So shots for kids could be coming as soon as this week. What should parents know?
Parents need to know, first and foremost, that the study results were phenomenal in terms of protecting kids from COVID-19, symptomatic COVID-19. And secondly, they need to know that the side effects were comparable to what we've seen with the hundreds of millions of individuals that have already been administered the Pfizer vaccine. And so we know there are not any alarms for myocarditis, not any alarms for these severe side effects that people are fearing. And myself being a parent of a 4-year-old and a 1-year-old, I'm in the same boat, right? But best believe we're going to line our kids up when they're eligible. They won't make this cut in terms of 5 to 11, but the next cut is coming. And I think parents should be at ease that it's going to protect the kids and get life back to normal more quickly.
So this is really good news, right? I mean, this could make a huge dent in the population that hasn't been vaccinated, hasn't been eligible to be vaccinated, and could really make a dent in the pandemic, right?
Absolutely. I mean, we're talking about 28 million individuals here in the U.S., right? That kids in this age bracket, 5 to 11. And so if we look at getting them vaccinated, taking them out of the pool of susceptibility, then we're making a huge leap forward in terms of preventing further mutations of the virus in the susceptible individuals. We're preventing, obviously, deaths. There's been over 100 kids in this age group that are not here today because of the pandemic and COVID-19. Almost 2 million hospitalizations in kids in this age bracket. So again, this is a huge leap forward, game changer for us, and I hope we'll see lining up parents with their pediatricians and primary care to get the vaccination.
And, you know, we're all warned about the winter season, the flu season, and when people are inside. But when you look at this winter compared to last winter, do you feel like we're on the upside now? Do you feel like we're past the worst of it?
I wish to say, I hope to say we were past the worst of it, but we are anticipating another spike. I mean, cold days bring close quarters. Obviously, getting as many kids vaccinated to help with this and to help with the communication of individuals in the home. That's where it happens. That's where we're seeing the community spread still in the home. It's going to be huge. And we're talking, again, kids back to school and the COVID being tremendously disruptive. My daughter right now is out of school for 2 weeks because someone in her class had COVID. And so if we can stop the spread there, we hope to be better than last year, but we're still bracing for a spike from where we are right now.
But more than half the country is now vaccinated. It's more than 60% of adults who have been eligible. People are now in line for boosters. And almost everyone, I didn't realize almost everyone is eligible for a booster in the United States right now.
And that's absolutely correct. You know, there are risk factors that put people in the front of the line for a booster, right? But in terms of exposure to individuals on a routine basis, that's part of the criteria now. And so we are urging people to get boosters if you fit into these categories. And we hope that people will line up. Now, if we look at who's lining up and who's not, I mean, we're still under 10% of the population that's received their booster, I believe 9.6. And we know that moving forward, it's kind of a rule of thirds. We know that there's about 2/3 of individuals who have received at least one dose, 66%. We're anticipating that 1/3 of parents will line their kids up. 1/3 will wait for weeks to come to see how things react. And then 1/3 will probably not show up to get their kids vaccinated. So we're hopeful that we'll have more showing up for their booster who's eligible to help us in this fight.
Is there any other good news to report when it comes to COVID right now?
You know, there is silver lining, right? Cases are dropping, you know, and so that is something that is a result of us being vaccinated, is a result of us still adhering to the precautions that have been in place. And we know cities and municipalities are considering rolling back the mask mandate, rolling back some of the additional precautions. But I think we should hang tight, at least through the holidays, and see how things go in terms of the numbers. But there is silver lining. We will be on the other side of this. Pandemic will be endemic eventually. And we hope to go into 2022 with not just 5 to 11 being eligible, but also, as Pfizer has said, they will submit soon their data for the younger generation here. We'll have 2 to 5 being able to be vaccinated also. So again, some positive things to report in terms of this pandemic as it goes.
Well, that's a perfect place to leave it because we always like something positive when it comes to COVID. Dr. Harris, thanks so much for joining us tonight.
You betcha. Thanks, Ruta Bay. Happy Halloween.
Happy Halloween. Coming up next on NewsNation Prime, Texas's governor signs into law a bill banning transgender girls from playing on female sports.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.